Welcome to Module 3.3. In this module, we will discuss different patient profiles and how to adjust treatment plan to each specific case. Learning objectives of this module are: understand the importance of multi-professional healthcare, know how to treat those with cognitive impairments, malnutrition, and diabetes, and know how to treat sarcopenic obesity. Sarcopenia is most common in elderly, therefore we can expect some other health issues as well. Patients are often diabetic, malnutrition, or have cognitive impairments. When advising and treating sarcopenic patients, it is necessary to look at the whole individual person with all health problems, both physical and mental. Multi-professional care is crucial in this case. It is important to contact doctor, nutritionist, or other healthcare professional who has been tracking patient's condition and progression of the additional health issue. Good collaboration and communication has good results and is beneficial for the patient. Cognitive impairments. Sarcopenic patients often also suffer from cognitive impairments. Cognitive impairments reduce neuronal volume in the brain, which leads to alterations in body composition by reducing skeletal muscle mass. Physical activity interventions have shown to improve both physical and cognitive performance. It has beneficial effect in those with sarcopenia, either by increasing strength or muscle mass. Research suggests that active lifestyle improves cognitive function and reduces brain atrophy. It has good effect on cognitive function and brain tissue integrity. When it comes to nutrition, vitamin B, folate, vitamin E, and omega-3 fatty acids have a potential to protect against occurrence of age-related cognitive impairments. These can be found in fruits, vegetables, and fish. Therefore, Mediterranean diet is recommended for those with cognitive decline. As learned in previous module, protein and vitamin D are crucial for those suffering from sarcopenia. All these components need to be taken into account when creating nutrition plan for a sarcopenic patient with cognitive impairment. In addition, sufficient hydration is necessary. In case a sarcopenic patient has developed cognitive impairment, which influences their behavior and performance of daily activities, this should be taken into account. Patients should be closely monitored and helped if needed. Make sure you approach the patient with empathy and support and motivate him or her to have a healthy, active lifestyle. Malnutrition. Good nutritional intake and weight gain are main goals of malnutrition elderly. However, weight should be gained in a healthy way, not only by increasing fat, but also muscles. Therefore, strength training is great for malnutrition. As seen in Module 3.1, this type of training is also recommended for sarcopenic patients, making it perfect intervention in case of both conditions are present. Be careful, as the person is probably weak, and start very easy. Exercise may also stimulate appetite. When it comes to nutrition, caloric intake needs to increase. However, it is important that these calories come from nutrient-rich, healthy foods. These should be dairy products and lean protein sources, as they are also important for sarcopenic patients. Diabetes. Resistance training, as shown in the Module 3.1, has a good effect on muscles in sarcopenic patients. In addition, it improves mitochondrial function, which is usually altered in patients suffering from type 2 diabetes. Resistance training programs should include both high-intensity training for improving muscle mass and lower-intensity training to increase mitochondrial oxidative capacity and enhance glucose transport. Then, training muscles get the glucose they need and blood glucose level drop. In addition, it helps in prevention of cardiac problems which often occur in diabetic people. Aerobic training might also be excellent for sarcopenic patients with diabetes. It helps in weight loss and also enhancing the effect of resistance training on skeletal muscle tissue, improving protein synthesis and mitochondrial bioenergetics. Very often, people with diabetes are also overweight or even obese. Therefore, the aim of their diet plan is to lose weight. Protein takes longer to digest, prolonging the feeling of being full, which can help in weight loss. As discussed before, protein is very important for sarcopenic patients. However, the intake should be monitored and proteins should be carefully chosen, avoiding products high in fat. Also, cardiometabolic risk, status, and renal function need to be taken into account before giving any recommendations to the patient. However, before setting a training program for the patient, make sure to contact the doctor who tracks his or her progression of diabetes. In the same manner, before advising patient on nutritional changes, consult their nutritionist. Sarcopenic obesity. Obesity aggravates sarcopenia as it increases fat accumulation into skeletal muscle. This leads to loss of muscle strength and reduced physical activity. Finally, it can result in disability and mortality. When treating obese patient, it is crucial to motivate him to change his lifestyle. First goal is weight loss. This may include loss of both fat and lean mass. However, studies have shown that reduction of fat is greater, making this intervention perfect for obese patients. Weight loss should be accomplished by altering diet and incorporating regular exercise training. Exercise intervention improves sarcopenia as it increases lean body mass and diminishes fat mass. It is recommended that the exercise program consists of resistance training, low-impact aerobic exercise, and high-intensity power training. When it comes to nutritional alterations, patients should have diet rich in protein and low in carbohydrates. This will lead to enhanced muscle protein synthesis. However, products should be carefully selected, avoiding foods high in fat such as fatty meat and cheese. General practitioner might also recommend pharmacologic therapy. Myostatin inhibitors and testosterone therapy have shown good results. This is the end of the last module of this online course. Good job! Your next task is to do the application exercises in quiz 3. After doing this, you're ready for assessment and intervention for class on sarcopenia. You will also be capable of detecting and treating sarcopenic patients in the future. We hope you enjoyed this online course.